Good afternoon. First of all, I'd like to thank the governor for gracing our city on this holiday Monday, and all the other officials and partners that are here today. This is a city that can rise up to a challenge, and we're rising up to the challenge that we're facing today, along with some amazing partners. The officials behind you are some of the elected officials that are supporting these efforts. And that includes Senator Formica, thank you for coming, Representative Nolan, and our Congressman, Joe Courtney. Thank you, Congressman Courtney. Thank you, Commissioner, for coming down today. And some amazing partners that are helping this city right now. And that's Ledge-Lite Health District, and you're going to hear right after me from the Executive Director, Steve Mansfield. But I want to recognize Jen Muggio, a really important partner in this battle, and Jeannie Milstein, our Human Services Director. They're doing great work. And of course, our host today, Yvette, thank you for your efforts. What we're doing is we are ramping up our testing in this community, and the residents are stepping up. Just in the last 2 days, we set up testing sites at Jennings Elementary on Saturday and at the high school on Sunday, and each day over 200 people went through those lines. And you can see the lines today behind me at the daily testing every day here at the Community Health Center. People are understanding the importance of knowing their status in order to protect themselves and to protect the community. We're also engaged in some very serious and diligent efforts at harm reduction. We are helping with food insecurity. We are helping folks get the PPE they need, the masks. We're educating the public. We're setting up distant learning pods so that children who don't have the opportunity to be at home have a safe place to go. This is an effort that requires the entire community, and we're thankful to have the support of an administration in Hartford that has been working tirelessly to get this job done over the last 6 months. With that, I'd like to turn it over to our local partner, the Health Director for the City of New London, Stephen Mansfield.
Thank you, Mayor, and thank you everyone for coming. I want to echo a few of the things that Mayor Passero said. We couldn't do it without our community partners. When Jen is the Deputy Director for Ledge-Lite Health District, when we looked at the data a couple of weeks ago and we saw the spike in New London, we reached out very quickly to the Commissioner's office at the Department of Public Health and said, we need help down at the local level. You know, we have great partnerships. We know what we need to do. We need help doing it. Local health departments have long been underfunded, and we need our partnerships, especially at the state level. And I can say we're very happy to say that the Commissioner's office has been incredibly responsive, as have all of our partners throughout the Ledge-Lite Health District community and in New London. So we're confident we have a good handle on this. The numbers aren't going down yet. We expect they will. And testing is such an important part of getting those numbers down. We did more than 700, with our community partners, we did more than 700 tests just this weekend. So every one of those tests that's done and the positive results that we may get back for a portion of those, that means those folks won't be in our communities potentially spreading the virus to other people. So it's a really important first step. So thanks again to our community partners, and especially all of our residents who chose to stay in line for sometimes long periods of time yesterday and over the weekend. They're committed to our community as well. So we very much appreciate them. And I absolutely have to give a shout out to my staff at Ledge-Lite Health District for burning the midnight oil for months on end. They worked tirelessly, and we absolutely couldn't do it without them. So thank you very much, and I'm going to turn it over to Commissioner Gifford. And again, thank you, Commissioner Gifford, for all your assistance. Thanks very much.
Thank you, Steve, and good morning, everyone. Governor, Senator, Congressman, Representative, Mayor. Thank you so much for having us here today in New London and for your focus on this important issue. I want to just echo Director Mansfield's comments about partnership. We're here with our partners at CHC, the local health department, municipalities, our partners in the state legislature, the governor's office. This really is a team effort, and as Steve said, we could not tackle this pandemic without this kind of partnership. So we're very grateful for all of you, to all of you for your work. I did want to talk about a really key public health message this morning that's part of testing. So it's wonderful that we've been able to do so many tests here in New London over the last couple of days. I echo Steve's thanks and the mayor's thanks to the residents of New London for coming out and getting tested. It's so important. But it's also important to know that testing alone is not going to help us turn the corner in this spike that we're seeing in this region. There's a couple of other things that we need to focus on. Obviously, the mask wearing, keeping that up, limiting our social gatherings, wearing the mask when you're not with the people that you live with. But there's something else that's critical, which is that an individual can spread the COVID infection before he or she knows that they have, that they're sick. And so it's very important that if you know you've been exposed to someone who has COVID, that you stay home. Stay home if you've been exposed, and obviously stay home if you test positive. And you need to stay home for 14 days if you've been exposed to someone with COVID. That's how we're going to break the cycle. We're going to break this chain of transmitting the disease if people who are exposed can stay home. The mayor talked about supporting people who need to stay home. If you need help with food, if you need help with other supports to allow you to stay home and out of work, then reach out to your local social services, to 211, to your contact tracers when they call you from the health district. They can help you with those supports so that you can stay home for 2 weeks. That's really critical in breaking the chain of transmission. So this is a wonderful event. We're so grateful, and to all of you who are participating. And now it's my pleasure to introduce Yvette Highsmith, who's the Regional Vice President for CHC, and who's going to talk about the events here at the clinic. Yvette?
Thank you so much, Commissioner, and to Governor Lamont, and to Mayor Passero, and to all of our elected officials, and to I just want to give a shout out to our absolutely amazing team here at Community Health Center, Inc. that has been testing daily, Monday through Friday, and literally testing hundreds of residents since we begun our COVID-19 testing, and we will continue to do so. On behalf of our CEO and President Mark Maselli, I want to say thank you to all of our community partners on a state level and also on a local level. We are doing this daily because it is absolutely critical to the health and wellness of all of our community, but particularly those who are most vulnerable in our communities. Kudos to New London County residents. You have been coming out and getting tested in droves, and you need to continue to do that. We have started testing in Groton as well. And so starting today, also Monday through Friday, testing is available at 481 Gold Star Highway in Groton. Want to just make note that this is testing at no cost. So there is no cost associated with this testing. You do not need to be symptomatic. You do not need a provider's order. You just need to show up for testing. You can drive up. If you drive up, you remain in your vehicle for the duration of the time. If you walk up, we can accommodate you as well. And so testing is available to everyone. And I just want to reiterate the importance of the precautionary measures. When we utilize them, they do work. They will be effective. And again, we want to ensure that we're moving forward in moving out of the conditions that challenge us around this pandemic. And so we all have to do our part. And so we remain excited about this partnership and are committed to doing what we need to do to ensure that all of the residents of the state have access. Thank you to all of our community partners that have hosted pop-up testing events to the school district for making sure that we were able to be at Jennings and New London High School this weekend, and to all of the faith-based community that is also partnered with us as well. We thank you. And at this time, I want to introduce our near and dear friend, Congressman Joe Courtney.
Thank you to CHC, which is a federally qualified health center. And when we look at the 4 COVID relief bills that have passed in Congress since March, every single one has always targeted community health centers as the platform for where you can get outreach to underserved communities, which a airborne pathogen, really doesn't sort of pick and choose or discriminate. It's everywhere, and that's why, again, CHC Inc. and again the great staff that provide such high quality care at almost no cost or very little cost in this region is so important. Governor Lamont and all of my partners in different levels of government, just want to tell you that sort of from the perspective of Washington, going back to last spring, it has really been a proud moment, I think, for all of us to be able to point to the fact that this state really did amazing work in terms of not just reducing the curve, but crushing the curve in as far as positivity, hospitalization, and deaths that have been caused by COVID. And I think, again, my friends who are from the area would proudly point out that Eastern Connecticut actually led the way last spring and summer with the lowest levels of positivity rates. That did not happen by itself. It happened because they did follow the advice that the commissioner laid out about mask wearing, hand washing, social distancing. Again, it happened even across the river over at a shipyard where people are densely populated every day doing amazing work for the country. And again, because of just a lot of smart work that was done, and we were able to, again, reduce the incidence of COVID-19 even at Electric Boat Shipyard. But today, obviously, we're seeing a little bit of an uptick, and that's why it's so important that all of us in Eastern Connecticut have to own this and have to really make sure that we are serious about addressing this problem, which every single one of us can take some responsibility and accomplish. Getting the resources here and standing up, again, clinics that are happening and testing, not just here in New London, but up in Griswold with Generations Health Center, again, the colleague of CHC, UCFS, and again, Bacchus Hospital and L&M Hospital. I mean, all of us working together can make sure that we get the tools out there to identify where the problem is, trace it, and crush it. And that's really the name of the game. The CARES Act last March in particular has provided a lot of the resources that have flowed through the state of Connecticut. And again, that's what's being deployed here in this region. I would be remiss, and I think the speaker would be very upset with me if I did not mention that we need another COVID relief bill. And what's happening here is exactly the reason why. And the discussions that are still ongoing in Washington, one of the biggest issues that still is a gap is really getting the number that we need for testing, tracing, and treatment. And again, what we're talking about here today is Exhibit A in terms of why that is so important and necessary to make that happen. I'm now going to yield the floor, as they say in the House of Representatives, to another great legislator who is here today and has been working very hard in terms of addressing the COVID-19 pandemic, and that's State Representative Anthony Nolan.
Good afternoon, everyone. I just want to come before you and I want to speak to the residents specifically in regards to this COVID-19. And I want to really do an all call, and I really want to reach out to you to try and get you to come and get tested. This testing is available for everybody, as was just said earlier. It doesn't matter who you are, it doesn't matter what age you are, We want you to come out and get tested. We want to make sure that New London beats this, and we want to make sure that we stay ahead of the COVID-19 from coming in here and trying to mess with our community. Especially all our team players, all our sports teams. Whalers, you know how we do. We always come out and we always represent the correct way. So I'm calling you out right now to come down and get tested, or go to a location and get tested, because we're going to beat this, and we're going to beat it good. Thank you. I'm sorry, Senator Paul Formica.
Thank you very much, Representative, and thank you for Community Health Center for the great work that they've done on this community for a very, very long time, and the work that's definitely needed to be done. It's been a pleasure to work with the Commissioner to move all of this prospects forward so that we can really eradicate what we're talking about today. Grateful to the Congressman, but I want to talk a little bit about last week when Phase 3 opened. I represent the restaurant industry, which has been devastated throughout the state, throughout the country. And, you know, it's nice that we're opening and we're moving forward, but that's also a message that we need to be vigilant, and we need to take proper precautions to make sure that we protect our staff and our customers and our vendors so that we can continue to move forward slowly, expeditiously, and in a meaningful and thoughtful and safe way. I can't echo more the words of our Congressman about the great work that's been happening here in the state of Connecticut, especially here in Eastern Connecticut, led by our governor, and we're very grateful to have him visit what I believe to be the greatest district in the state and representing the greatest country in the nation. So it's my pleasure to welcome Governor Lamont and thank him very much for all the good work he's doing. Thank you.
Hey, thank you, Paul. I love being in one of my 5 favorite districts here in the state of Connecticut, in what is absolutely the greatest country on earth. And you're right, when it comes to restaurants, when it comes to Phase 3, we're slowly and cautiously opening because we've earned it. But we got to continue to earn it every day as we make sure that we beat back COVID. And I think you can see from the group that I'm with here today that this is a partnership. This is a team. And, you know, led by Joe Courtney down in Washington, D.C. I need more Joe Courtneys in Washington, D.C. I got to tell you, we need a partner in Washington. And you're right. You made a big difference in that CARES Act. And we need to know what's going to be happening going forward. That's what we need reaching out. And in the meantime, we can't sit around waiting. We got to take control of our own fate. And, Mike, that's what we're doing right here in New London today. Because we know that there's been a flare-up around the region. We've seen this movie before, and it's going to have a good ending. You know, it's flaring up in Boston. It's flaring up in Providence. It's flaring up in Brooklyn and Queens. And it was just 7 or 8 months ago that you saw it come down I-95 in the Metro North Corridor. And we were hit pretty hard going back 5 or 6 months. And as Deirdre pointed out, it's going to be very different this time. It's going to be very different because, A, we know what we got to do. We've doing tons of testing. We've done 150,000 tests in the last week. You know, back during the early days of the pandemic, we were doing maybe 20 tests a day. And that means we can keep an eye on what's going on. And when we ramp that up right here in New London to make sure that we're ahead of the curve and people know that if they're not feeling it all right, even if they're just want to come and get tested, come get tested. The line is short right here, and we need you to do that and be careful. And as Deirdre said, and then quarantine. If you've been in contact with somebody, quarantine. If you test positive, quarantine. That's how you're going to keep New London safe going forward. I got to tell you, we just got our numbers again. We're still at about 1.4% positivity rate. That's over the last three plus days. So that's still one of the lowest in the country, but it's up a little bit compared to where we were a few months ago. And we're going to continue to battle this back. And but right now, the reason we're here in New London, the reason I'm going to Norwich, the reason we've been in Danbury is that we're bringing in the cavalry. We're bringing in the rapid response team, what they can do in terms of testing and quarantine, and make sure that you have all the equipment you need to take care of what could be a potential small flare-up. And in the meantime, we haven't been sitting idle by. We've put in place a stockpile here at the state. We're hoping the feds have a stockpile, but I'm never quite sure. But we do right here. We have a 3-month supply. Yvette, I hope you have a supply right here at the Community Health Center as well, of masks and gowns and everything we need just to prepare us for what could be coming forward. So we wanted to be here in New London to let you know the team is here standing with you. Come take advantage of all the resources we can. Come to this health center. Go get yourself tested. No questions asked, no cost. We're doing this to keep you safe, our community safe, to make sure we get through this year, and looking forward to a great future next year. Thanks, everybody. Any questions for Senator Formica?
Governor, the contact tracing, as we look at it and identify, where are most of the contact tracing going to? Family situations, small gatherings, what?
Well, I'll start, and then I really need Deirdre to help me out with this. But I'll tell you what we heard from Deborah Burks, who maybe you know from the COVID task force, flashy silk scarves. You know, she said, right now, we see the infections not happen at the workplace, not necessarily in the classroom, not in the church, and actually not in the restaurants, because the restaurants are being very careful. What we see is these informal social events, where that's where we've got to do the track and trace. That's where we need families to be particularly careful. And we're rolling in the track and trace team right here in New London and elsewhere to make sure we can get to the bottom of this. But Deirdre?
So just to add to the governor's point, a couple of specific instances that I would call out. Carpooling. We're seeing that people are taking off their masks when they're driving together to work, and we've seen some spread happening there. The lunchroom. Obviously, you got to take your mask off to eat your lunch, but if you're going to do that, best to eat outside, obviously, whenever you can. And then if you're inside, you've got to keep that distance as much as possible. Stagger your lunches so there's not a lot of people in the lunchroom. Family gatherings. People coming over, they think, well, I'm related, so it's okay to take off the mask. And we're seeing spread happening there. So nothing new, but it's just, as the governor said, the vigilance to keep reminding ourselves, mask on, over the nose and mouth, if you're with anybody that's not part of your household.
You had mentioned 3-month supply of PPE and other necessities. Is that going for the actual tests as well? Is there plenty of tests for all the ramp up in testing?
Yeah, we do. We have a lot more testing capacity, and more to the point, we're using local labs wherever possible. So we're not stuck sending tests all the way to the West Coast and waiting 3 or 4 days. So I'd like to think we have a lot of testing capacity right now. As you can see, we ramped it up from 100 a week to 150,000 a week. And we're ready to keep going. We'll see what the spike might be. We'll be ready.
Governor, you made a decision or issued a decision about allowing town leaders like Mayor Passero to roll back phase 3?
Yeah, we're going to be issuing an executive order within, the next couple of days. And the question is, for those communities that have a higher infection rate, give the mayor some discretion, whether they want to stay in phase 2 or move to phase 3. And we're going to give them that discretion. I think it's always better to err on the side of caution, to tell you the truth, but we're going to give every mayor that discretion.
And you're just working on details of what kind of discretion? Or?
Bob Clark, he's the attorney. He's got to draft this. It's going to take him another day or two.
Governor, can you talk a little about why the delay with this executive order? Because right now, these towns that maybe would have stayed in phase 2 have been forced to go into phase 3.
We got some feedback from mayors. They said we'd like to have some discretion. Every Thursday, we're going to release the map, which is going to show you exactly where your community is in terms of COVID infection, where they are per 100,000. So we'll have discretion out to our mayors before that next Thursday, so you can see where your town is in the COVID infection map.
What I'm asking, though, is can you talk a little bit about why this wasn't put in place before phase 3 began last Thursday?
I think, going back a week ago, we thought maybe we'd just do everything on a uniform basis and everybody would go to phase 3.
And then we saw some flare-ups going on around the rest of the state, and we knew some mayors wanted some discretion. Thanks, everybody.
Thank you.